So public health has to work at a population level, and in order to do that, we recognise, for example, that there are national school food standards that are mandatory. So working with school meal providers to look at reducing sugar, we will be considering those strategic aims at the same time working with individual schools and also with community groups that are linked to those schools. Well, we knew through work over quite a number of years now with the family support workers to do about family food and well-being, that really their concerns to do with obesity, with food poverty, with generally, coping with making choices in the everyday environment. So we set up a project where schools could describe themselves what they were interested in and how they could learn and communicate health eating messages. And we also specified that they would tell us how they met quality standards, because obviously food safety, allergens and knowing basic nutrition, it would be important to have the highest standards there. So the school food projects were the main part, and we now have about 44, which is nearly half of schools, so that's quite a good achievement in the time we've had. They're wonderful projects, and they range from cooking, obviously the most popular, food growing, which is the next most popular, and ever increasing. Then there's projects to do with healthy breakfasts, healthier snacks, healthy lunch boxes, and even a few looking at food waste or sustainability. And then we have projects as well looking at the social, the dining atmosphere. So that's where the link to the caterer, the school cook, becomes more clear.
Our initial project was a gardening project, getting children involved in planting, weeding, growing various plants, potatoes, garlic. After a few months, when the foods and plants were ready and ripe to be harvested, we then gathered all these plants and foods, and these were distributed to the children for them to take home and try at home. That plants that were not used were then passed over to the school's kitchen, and the other plants were then passed over to the community centers for their usage. From the planting projects, we then were influenced to do a Change for Life, where we started looking at thinking about healthy attitudes, healthy living, healthy lifestyles. We then got children involved in our Change for Life clubs. We've got parents that came in to support their children in the Change for Life clubs. We done sugar swaps, we done smoothie bags, loads of healthy initiatives that changed attitudes and changed lifestyles, and is continuing to do that.
It's been helping me to dance more in my house and to let my mum make me go dancing clubs sometimes. And I've been enjoying doing skipping because it makes me sweat, and I need to sweat sometimes, and I just need my blood to keep on flowing.
Well, the mindset of the children first thing has changed. The influence of the children on the families has changed. The school has now looked at waste management as well, and the food that we're wasting. So we're now in the process of contacting the kitchen staff and the kitchen agency and the caterers, where whatever is left over is now going to be bagged and taken to community projects like the food action groups and the food banks. So if you're asking where we started off to where we are going, it's absolutely brilliant, the changes that we've done in the school.
Having a healthy lifestyle is kind of life-changing, because some adults today have been smoking, and when you do healthy lifestyle, you can not have a shorter life expectancy, but you can have a longer life and just live it to be fit and eat vegetables.
Samwell can be very proud of the work that is happening in the local community, and I think really to see what we're seeing in public health, the learning and the enthusiasm and the generation of ideas, this is the type of social innovation that will lead to healthier lifestyles and healthy life expectancy for the younger generation.
I ticked to go to Change for Life again, and I've been selected to, so I can't wait for this Thursday or next Thursday to go to Change for Life and get another healthy lifestyle at school.